Good morning, everyone, and welcome to this Gemba 360 legal update around the Stage 3 COVID-19 rules, enforcement fines, and also mandatory vaccinations session. My name is Nihal Samra. I'm the General Counsel and Legal Director here at the law firm Tenancies and Synergy. We are running this session, and we have been running these specific sessions around COVID-19 updates, specifically after premiers from around the country have made different announcements, and also as the Prime Minister Scott Morrison has also made different announcements, and different releases are subsequently made from the relevant government department as well too. Today's session is specifically focused around some of the rules, enforcement fines, and also covers off the mandatory vaccinations that have also been released as well too. We will be covering off jurisdictions across Victoria, New South Wales and Queensland specifically in this session. Other sessions we'll be covering for the likes of WA as well too, in a separate and Tassie in a separate group. So with that, as always, we'd like to pay our respects to the elders past and present upon the lands on which we all meet. While this session is being run by webinar, we do pay our respects to the traditional owners accordingly. So some of the topics covered some of the topics that we're actually going to cover today are these ones here. With them, it's not so much the rules around keeping distance from other people, but it's really about how those rules actually apply that a lot of people are actually having some degree of confusion with. Some of these include: what is daily exercise? Can my partner, not family member, visit me as well too? What does this mean with more than 2 people in a household? Right down to other questions, which is one that's actually been frequently asked as we've run these sessions, is: can I look after my grandchildren for my children who work at community organisations? And that's quite a common question, where, especially in this sector covering health and community services, where people might be working within a given health service front line and coming into possible contact with COVID-19, people that have tested positive for COVID-19, but also their children also work in the same or other similar agencies as well too, but they don't want to put those children into daycare, even though the government's current policy is that that's okay for those services. So there is questions around that. Other questions that people have asked is: what do I say if I get pulled over by police? And this has happened to some agencies as well, to some people as well too. And so with that, from traveling either from work to workplace, what do you say? And there is a lot of fear amongst this as well too. And a lot of the people that are joining us are actually doing the right thing, especially in the health and community sector. You are doing the right thing, but there is a lot of fear and anxiousness across whole agencies in terms of dealing with this as well too. One of the other pressing issues, which we'll also cover, is: what about tenancy agreements and rental issues? And again, we work with a lot of refuge houses as well too, and also safety houses as well. And with that, questions have been asked of: can my landlord actually kick clients out, or can the landlord actually kick clients out of rented houses, and what does that actually mean? So let's cover some of these issues, and we'll go through some of the rules as well too. As we announced previously in our previous webinar, which is we've made available through YouTube as well too, Victoria did lead the lockdown stage earlier on, and announcements were made. Quite simply, across the different states and territories now, there is a fairly consistent message with this. And this was really around 4 reasons to leave your home. And a lot of this is really around the rules around what the state premiers are sending out and what the chief medical officer across the different states are actually consistently saying. That is to get, the 4 reasons really is to get medical care. The second is to go to work, either work and study if you can't learn or work remotely. The third is to do your daily exercise routine. The fourth is to buy the things that you need when you need them, but not to window shop. And we took this slide previously from our other slides. That's why it says this will be made from midnight tonight. But again, nothing has really changed since we came up with those particular rules, and that's been something consistent that the chief medical officers have also been saying. The purpose of this, and I think this is what we're going to keep coming back to, and when a lot of agencies and staff contact us and ask us sort of the questions that I raised before, we actually go through to what the ban is and what the on-the-spot fines actually are as well. The ban is there, and all these rules are there, is to protect people's health and well-being, to protect the health system, and really to protect key jobs as well too. And with that, there is a fair degree of looking at, well, how does this actually impact what you are doing at the time? So the rules around this, quite simply, is then these came in down in Victoria on Monday, the 30th of March at 11:59 or midnight. May as well be midnight, as they said. But effectively, National Cabinet, which consists of all the state premiers as well as the Prime Minister's office as well too, effectively made a decision that gatherings will be restricted to no more than 2 persons, except for members of your immediate household and also for work or education. Now, there had been some confusion around what your immediate household would be, and I'll come to that in a minute as well. So effectively, under the rules of this is that under stage 3 restrictions, the new directions mean that what was previously advised about staying at home will effectively, and has now, become enforceable. So this effectively covers things like your skate parks, your outdoor gyms, effectively close, and if you are there, then you're potentially going to get a fine if you attend or are seen in those particular settings as well. So with let's just go what this means in terms of what they mean, and there has been a change on what the gathering of 2 people mean. The first was that all gatherings should be restricted to 2 people, except for within your own household or for work or education purposes. As part of that, what we now see is that this has been extended to your partners as well too, by the chief medical officer as well too, and if your close partner that you've been seeing for some time equally lives in a different household, then this can be counted as well too. So what we also, and this was a question that actually arose earlier this week, what if that person is traveling to your household, or if you're going to that person's household? And again, if it's a gathering of 2 or more people, then effectively the question that was asked was, what do I do if I get stopped by police, and do I in fact say that? And we've had chats with the police around this, and really the discussions around this and the rules that we see is to, when we go back to what is trying to be achieved here, is to limit the contact of people just to who you need to see. That's really what this is about, and keeping those social distancing rules. So if that's the case, there's no other kind of story that you need to come up with, but in fact, just say what is actually happening. You're going to see your partner, that's a close family member, and you're visiting, you're seeing them. And that's effectively would cover what we are talking about here. And it also means that there is you're meeting them a gathering of no more than 2 people as well too. There is also questions that at the moment is even yesterday, announcements made that the childcare centres do not pose a significant risk or significant transition to the community. Despite this, I will raise that a lot of agencies and people that work in the health and community sector have actually raised with us that they individually, and this is their personal opinion, this is not my opinion, this is what we've been asked, don't feel comfortable in sending their kids to childcare for a number of reasons. The first one that they actually said was to protect other kids as well too, because people work in the healthcare sector as well and they're frontline as well too, that they don't feel comfortable actually leaving, so they've actually offered to do that for with somebody else that's circle. And so with it, it's a decision that it's unique to each family group and each family circumstance, and also looking at the risk that this poses to you and your family as well too. Some of these decisions is much more around looking at the rules and effectively saying, well, if people are going to be of the vulnerable population group, then equally you need to have a look at those risks at your own families as well too. I'll jump past the wedding side because we covered that in our previous session. But the other one that we did have a lot of questions on was about the rules for tenancies and how these impact on especially either families that are in safety houses or refuges, but also if other landlords then seek to evict people because they've lost their job, or sorry, not because they've lost their job, because they can't pay the rent, and what this means for tenants. Well, effectively, what we have seen is that earlier in the week, there was a decision by National Cabinet around this, that there is a moratorium on evictions, which will be introduced for the next 9 months across residential and also commercial tenants who are experiencing financial distress due to the impact of the coronavirus. And this is actually a fairly broad statement when we say due to the impact of the coronavirus. It doesn't mean directly that one person has lost their job. It could be the person that they're residing with has lost their job as a key income for this family group or this group of people. Or the tenants, should I say. Equally, also, if the network has also been affected as well too, then that could their friendship network group has been affected as well, then this equally can have a detrimental effect. There is talk already this morning, an announcement made this morning that National Cabinet will provide much stricter guidelines and policy directives on this. Some of these landlords may include the states, governments as well too, or funding from the Department of Housing or the Department of Health, for example. Equally, there may well be a lot of private landlords that are equally claiming eviction notices and the likes. At this point, as it states here, and this was something that was issued before, that there is a moratorium on evictions that is being introduced for the next 6 months across both residential and commercial tenancies as well. And it's specifically focused on those groups and people that have been directly affected by the coronavirus as well. This is a significant health impact, and I will add here that one of the public health concerns is that the security of having a house, especially during a public health emergency like what we are seeing now, is a significant assistance to have a housing and a place where people can safely reside and have effectively a safe harbour. To take that away is a major issue on its own. So effectively, the government has stepped in, and rightly so, and this applies across to all states and all territories, and there will be further announcements from what we have seen coming out of National Cabinet around how this is to be applied and what this will and how to actually direct this. But effectively, at this stage, there is a moratorium on evictions for the next 6 months that cover residential and commercial tenancy agreements as well. And it is something, especially if your agency acts in that space as we mentioned earlier in the week, it is something to be very, very clear about and mindful about and inform your clients about as well too, especially for those services providing very specialist and safe refuges for vulnerable people. In terms of the fines, this is something that slightly does vary from state to state, and we'll cover each of these now, especially for those agencies that are located across state lines or border towns, but also for those delivering services across state borders as well too. Effectively, the fines work in exactly the same way. It's really around the quantity of what's actually being imposed. In Victoria, the Victorian Police have been given the power to issue on-the-spot fines of up to $1,652 for individual people and up to $9,913 for businesses. What I will add to this is that when we have had talks with Victoria Police around this, they are giving people warnings in the first instance around it, but where there are significant breaches, they are not hesitating to actually issue fines. There was a group of people that we had a discussion about with one particular police officer around this, and effectively there was a group of 6 or 7 youths that were causing problems, and not only did they impose other fines, but they actually issued about 6 or 7 on-the-spot fines directly to them as well too. Equally, in Victoria, the first fine was also issued to a Melbourne bar. The China Bar was the bar or restaurant or name that was actually issued the on-the-spot fine earlier this week, and again it was covered in the media as well too. So again, there are patrols, we hear about it, that these are in fact happening, and the police have been given these powers and they're under direction directly from the Chief Medical Officer. Equally, in Queensland, officers now have the similar powers, but the on-the-spot fines are up to $1,334.50 for individuals and $6,672.50 for breaches by corporations. Under the direction, homeowners or persons in control of a residence must not allow more than 10 people to be present at the residence at any one time, and to take reasonable steps to encourage occupants of and visitors to the residence to practice social distancing measures as much as possible. And it's interesting here, I will raise that we've seen other places, other jurisdictions as well too, also raise the same thing, that if you are or your company is actually in control of a particular property and there are multiple tenants, it could be you've subleased your service area out to other agencies and they're not complying, then you could be held accountable as well too. So it is important from both your agency and personal point of view that you really follow and look at what these enforcement measures are. Even this morning, the PM came on the news and made the announcement that these types of measures could be in place for at least the next 6 months. And it is obviously important that you start to be aware of what some of these enforcement measures will look like and what the impact of these will be. In New South Wales, people who break the new rules aimed to stop the spread of coronavirus now could face 6 months in jail and fines of up to $11,000. The New South Wales government is urging the community to keep social gatherings to a minimum and obey new regulations to ensure that this, because the state boasts currently the highest number of COVID-19 cases in the country. And so what they're finding is that some of the population groups, the 20 to 30-year-old population groups, are actually seemingly what the Premier has mentioned is actually that in New South Wales, the worst group of offenders for isolating, for maintaining these rules. So as you can see, as part of this whole process, the rules are there around the social distancing measures. Some of these now include and apply to corporations, especially those that are in charge and manage building sites as well too, or office space as well too, or residential areas as well. And it applies right across the board to a range of services. The other part that I did want to just cover off was around mandatory vaccinations. Now, this was something that has actually been raised in down in Victoria, which I will mention here, but we think it's important to actually look at across different states. But we will use the case example here in Victoria to actually explain how this and what this could mean. So effectively on the, on Wednesday, the 19th of February 2020, earlier this year, effectively a directive was provided about making vaccinations mandatory for all healthcare workers. And this was actually made specifically under new legislation under the Health Services Act, Mandatory Vaccination of Healthcare Workers Bill, which was introduced in Parliament back in February. Effectively, these new laws will mean that healthcare workers must be fully immunised to protect themselves and patients, our clients, against the flu each year, as well as whooping cough, measles, chickenpox, and hepatitis B. All healthcare workers, based on the ministerial directive, was stated that in public and private hospitals and ambulance services with direct client contact, these will be required to be vaccinated, including doctors, nurses, paramedics, dentists, orderlies, cleaners, and staff working in public sector residential aged care services. The directive is that workers who refuse to be vaccinated may face work restrictions or be redeployed to other parts of the health service itself. Now, what was raised was whether this should actually be included as also part, considering what we're undergoing now with the coronavirus as well too. And it was interesting because equally yesterday it did come out under the Chief Medical Officer's guidelines that it was recommended that effectively, and the directive provided, that both this be employed as part of the flu vaccination because they don't really want to see people in the front line having both the flu and also the coronavirus as well too. And that came out of a directive which supported what we had said earlier in the week from yesterday. So with it, there has been questions by a number of agencies saying, well, should we continue to go down this path? And it would appear that the answer is yes to this, especially if you are providing these particular services as well. The mandatory policy around this, I think it's safe to say that the position is fairly strong around this, and the directive is fairly strong around this in terms of what is expected, because it's not only about the staff members, it's actually equally keeping the community safe and spread of other diseases and viruses at the same time. So as part of these recommendations, we've covered off what the rules are, what the enforcement provisions are across Queensland, Victoria, and New South Wales. We've also looked at some clear examples around some of the new enforcement provisions that you should be across, and also what are the mandatory vaccination requirements as well. As always, we also outline what the recommendations are for your agency to follow. You will find that we've suggested that you update your policies, that especially around the coronavirus policy packs, especially around some of these areas, and as it continues to escalate, and the Prime Minister gave some direction that there will be some further escalation, even though it looks like this coronavirus appears to be across the country starting to slow down, but there may well be some further escalations as well too. As part of these recommendations, what we are suggesting is you keep your policies in alignment with the Commonwealth and relevant state directives. As part of this, following these 4 simple rules around this is equally the position to take as well. It's certainly as things then start to be stand down and started to be changed, then again you can start to relax your positions on this. But effectively, until that time, the recommendations are to make sure that your policies and directives to staff are equally in line with the Commonwealth and relevant state department as well. Of course, there are things around the disaster systems that your agency should now well be in, and also if you're not, looking at ramping those up to make sure that people and your communications is managed effectively across your agency as well. With that, we will open up the phone lines for questions, and at this time we'll stop the recording. Just before we do that, as always, if you do have any questions after this session, you can contact us on 1300 360 360 or email your questions to support@gemba360.com. Our service is supporting all health and community service clients across different states and territories, and with that, our phone lines are open now 24/7 as part of this whole pandemic and public health challenge. So support is certainly available to you should you require it, especially around the disaster work that we are working with a number of agencies right across the healthcare spectrum. So if you do need support, you certainly do have ready access to it. So I encourage you, if you do have any questions, by all means contact us on the 1300 360 360 or email us at support@gemba360.com.